Inspired by Love is a podcast hosted by Rachel Love, dedicated to promoting inspiration, hope, and giving a healthy dose of God's love for every aspect of life. Rachel is a seasoned inspirational enthusiast who uses witty commentary and biblical truths for real-life solutions, offers business strategies, health and wealth tips, and self-love care. Unlock the power tools to dig deeper, discover your untapped potential, and live your best extraordinary life. Here's your host, Rachel Love.
And welcome to Inspired by Love. I'm Rachel Love, and I am so excited, because today is March 8th. And if you didn't know, now you know. March 8th is International or Women's History Month, and we are celebrating today. I have my good friend, Miss Alethia Candy Finley. Candy, welcome to the show.
Hi.
So how are you, dog? I just kind of want to know, let's just catch up real quick. How have you been doing since this whole pandemic, corona? What's going on in your life?
Wow. It's been crazy. Last year, I kind of shut myself down. I went to the Super Bowl, and then when I came back, but even since January, when I started traveling, when I saw what was going on in China, I started making sure to carry my Lysol and my mask, and I was spraying my seats and wiping them down on the planes because I wasn't trusting it. Then I started being extra vigilant in my hotel rooms because I was traveling a lot.
Mm-hmm.
And once everything started kicking off here, I put myself in a quarantine before it was announced. I did it 2 or 3 weeks before that. And I stayed in the house for like almost 6 months straight.
Really?
I was doing Instacart and different things like that for my groceries. If I had to get gas, I would do that, but I wasn't seeing my mom. I wasn't seeing anybody in my family. My son came to my house twice outside, like nobody was inside because I wasn't comfortable. And then in May, I took the only trip I took last year to see my dad before Father's Day because
Wow.
he lives in Washington and that's where everything started. So I was
Oh,
really worried about him. And I was like, I just got to see him because what if he gets antsy and just feels like he can't take it anymore and go outside? So I wanted to check in with him. But other than that, when you live alone, it's very
yeah.
lonely. You don't have anyone to talk to or touch. That connection is very important. So it kind of made me think about elderly people that live alone and how they must be struggling. If I'm struggling, they must be struggling even more because at least they could go eat McDonald's or something and sit outside and watch the ducks and the pigeons and children play.
Exactly.
I mean, they couldn't taken away.
Exactly. Exactly. Well, I just kind of really wanted to, like I said, kick off the month. Today is the celebration for Women's History Month. We are actually wearing our purple in solidarity for loyalty and, steadfastness and just all that women bring to, professions. I mean, women as mothers, women as caretakers, women as nurses and doctors and lawyers. I mean, women all over the world should be celebrating. So I'm so happy that you said yes today and that you came on to the show. So Candy, can you tell us a little bit about yourself? Like, what do you do as a profession and how long have you been doing it?
Okay. So I've been a registered nurse for about 29 years now. Currently, I'm a clinical nurse educator for a specialty infusion company. I've been in this role over 6 years. Prior to that, I was doing sales for maybe about 5 years. I was
Okay.
doing sales. My role was called a clinical sales liaison. So I was working for the pharmacies, doing
Mm-hmm.
referrals, getting the business from the hospital to home.
Oh,
So,
okay.
yeah, so I was in the field. So I was on the sales team, and that was my first introduction into sales because I was a nurse. I like hands-on bedside with my
Mm-hmm.
patients. So they kind of had to kick me and force me into that role because they needed a position and they felt like filled, and I was the only one that could do it. I was
Oh.
like, okay, yeah, because I like to dress up.
Mm-hmm.
So they pulled me from my infusion suite that I was running and put me in that role. And I never looked back. I did
Oh.
good. Yeah, and I loved it. So I'm like, okay, I miss hands-on patient care, but I like what I do now because I feel like this is for the patient, educating nurses, making sure their skill set matches
Mhm.
the patient's needs. And I like doing what I do. I interact with doctors sometimes, my pharmacy team daily. And I still talk to patients sometimes when they're having reactions or infections or different things, just trying to help them navigate through this and educating our nurses on a daily basis, even
Okay.
with COVID,
And
we
that will definitely set us up for the next question, because now that we're in a global pandemic, how are your nurses that you are educating? How are they navigating their daily duties? How are they serving the patients?
so for my pharmacy, we do provide PPE for our nurses that are seeing the patients in the field. Um, when when it first started, like a lot of patients didn't want a nurse to come into their home, or
Mhm.
patients that were in infusion suites were afraid to go to the suite, so they wanted to infuse at home. So we were seeing different things, and then we started doing virtual teaching trains where we were teaching
Mm,
patients how to administer their meds. So I had to make sure the nurses could do that, because it's one thing to be there hands-on teaching someone something, and then when you're online trying to teach them and you can't show them how to use the equipment. So I
exactly.
had to make sure I trained the trainer even more. But it went really well. So last year we had a lot of success with that. But this year we're back into the more nurses seeing patients in the home. And some companies that I deal with, they have specific nurses that just work with COVID patients, because every
Hmm.
nurse doesn't want to do that because they have underlying conditions too.
Oh,
So you have
yes.
to be careful. Yeah. So it's been interesting.
Yeah. So, what would you say to our listeners, anyone that may be listening, that may be struggling with just everything, the information that is being disseminated? How, as a healthcare professional, would you help, civilian people like myself try to understand how to protect themselves? So when we're interacting with people, we're not only wearing a mask, we're washing our hands, but what else can we be doing?
We're supposed to social distance. So you're
Mm,
supposed to be 6 inches away from everyone.
okay.
No hugging, no kissing, no close contacts. That's why they closed all the restaurants and stuff down
Mhm.
out, and you went to the outdoor dining because it was safer. But then when people started putting tents up, it's like you made another enclosure for the
Yes.
virus to be spreading around. So it needs to be just open. But I always say follow the science. That's what we
Oh,
have
science.
scientists and doctors for. So I follow the CDC guidelines. So
Mhm.
my education and my company to nurses, the information can change daily. You have to
Yes.
stay updated with that information to make sure you are telling them the
Mhm.
right thing. But even with the vaccine now, and I just received my second vaccination
Mhm.
recently, you have to still wear your mask, still wash your hands, and socially distance. We
Mhm.
have protection, but that does not mean you cannot catch the virus still, because the vaccine is not 100%. What they're saying is if you get it, you won't die. You know what I mean? Without it
Yes.
and you catch it, it's a risk of death. But with the vaccine, you may have some mild symptoms, but you won't die.
Yeah.
So
Can
you
you
won't
talk
be
a
hospitalized.
And can you just expound on, someone that has had it, and like what were the symptoms? What did you have to deal with?
So it varies. You can be asymptomatic, which is a
Mhm.
carrier that has no symptoms, no signs or
Wow.
symptoms, or you could be symptomatic, which that's what I had. I was
Mm,
sick almost instantly. So, but I was in contact with a family member that traveled from out of town and they were
mm,
asymptomatic. So
mhm.
they brought it and went to visit everyone in the family.
Oh,
So my symptoms were loss of taste, loss of smell. I
mhm.
had no appetite. I had fatigue and weakness. I had headaches, but I didn't have a fever. I didn't have a fever and I didn't have a cough, but the congestion was horrible. It felt like trying to
Oh,
breathe through a brick. Like that's how stopped up I was. And I
Mm-hmm.
was sick for 2 weeks. And once I returned back to work after that, I still had headaches every day
Mm-hmm.
for like about 2 months. And then I had some mental fogginess, like, and then trying to get my endurance and stuff back. And I lost a little weight. I wasn't mad at that part though.
Well, I know that you're an avid fitness guru. You work out, and I've been
You know,
following
girl, let
your chronicles. The number 149 fanner right here. If anyone is
right.
wanting to know, she would be the one to ask.
Yeah, but things that we can do to help protect ourselves, you have to keep your immune system
Okay.
up. So Dr. Fauci recommends taking vitamin D, zinc, and vitamin C
Mm-hmm.
every day. So I've always been a person to take vitamins. I already had my regimen, but I
Okay.
incorporated the things that he said,
Mm-hmm.
make sure I was boosted up enough. And
Wow.
then you drink plenty of water, get rest, and exercise.
And
All those things
exercise.
that
Wow.
keep your immune system up.
Mm-hmm.
So even with all that I was doing, someone still came to me and I caught it, and I'm healthy. So, but I mean, I didn't end up in the hospital. I was able to take care of myself at home alone, but I did it.
And see, that's all I wanted to say. It can be done. We have to take the necessary precautions. And I
Yes.
think it's like the word says, he that has an ear. He's not talking about these two ears on our head. He that has a spiritual ear, let him
Right.
hear. So
Right.
you're giving information that we all should at least apply to our lives, not take things for granted, wear a mask, social distance, wash our hands, take every precaution that we can, and not just be fooled because the powers that be are saying, oh, it's okay, we're opening, don't wear your mask, everybody come
Right.
on in. No, use
Right.
common sense. That's
Yes.
all I'm saying. Use common sense.
Yeah.
So, in addition to celebrating Women's History Month, what are some of the obstacles that you have seen in the nursing field? And now that you've actually elevated to another position, how is it difficult sometimes to kind of get pigeonholed in a position and, maybe overlooked for opportunities?
Well, I think a lot of times, especially for women of color, we get overlooked a lot because of that. I mean, your knowledge could be surpass everybody else, but because of that, you will be overlooked sometimes.
Mm-hmm.
But I just say you have to do your best. That's all we can do. Do your
Yes.
best. Make sure you stay on top of your education and knowledge in your field. Take classes. I mean,
Mhm.
for nurses, we have to renew our license every 2 years. But in
Okay.
addition to that, you can still learn new things. So you
Mm-hmm.
can share that knowledge with others. Or if you are trying to get a position, you know what I mean? You take some extra courses and get some certifications, then that can help you as well. But
Exactly.
but nurses, I think we do pretty good overall. I mean, we are the most respected field, and then especially with this pandemic, seeing what nurses and doctors are doing, risking their lives every day to save your life. It's a lot of people wouldn't do that.
I just want to say, on behalf of me, my family, and everyone else that may be listening, thank you for your service. Thank you for being a front line intervention, preventer, educator. You definitely, your field, that's including nurses, doctors, any METs, anyone that's working in the field of medical. I want to say thank you, because it is a very selfless position. It's a selfless
Right.
job. You don't think about yourself. You're thinking about
Right.
others first. And so
Yeah.
there's so many nurses and doctors that have contracted COVID and unfortunately have passed away, but doing something that they believed and loved. You know what I'm saying? So we definitely don't want to put any negative connotation on it, but just really educate ourselves. So if you are desiring to get into the nursing field, this is something you definitely want to at least look at. You may not be a nurse per se, but maybe you can be an educator. Maybe you can be a blogger. Maybe you can be something in the field and, maybe not actually have interaction with patients.
Right. It's so many different areas when it comes to nursing. It's
Mhm.
not just bedside. It's probably 100 different things you can do. They have the legal aspect, I mean, it's so much education. You have like plastic surgery. I mean, like when you think about it, it's really a
Yes.
lot. You have in-home nursing, you have nursing in infusion suite, nursing in the hospital, outpatient setting. It's so much to do.
Yeah,
You
yeah,
don't have to
yeah.
do just one thing. You can do something new every year if you wanted
Oh,
to.
now
It's pretty
that's
cool.
encouraging. Actually,
Yeah.
that's very encouraging. So it's not just a dull, mundane, especially now. It's always changing.
No.
Every
Yes.
minute is something different. And so I think that's why people were really glued to the televisions and just listening because all the information that was coming out, it was really, really it was interesting, but some of it was just kind of going over our heads because we didn't
Right.
we didn't get the gravity of it, and it's like
It's overwhelming. Overwhelming. That's what I always say. Like when someone is ill and you tell them something, they only hear a little bit of what you said. The rest of it just glossed over. So you have to reinforce and
Mhm.
make sure they really get it. And that's the same thing with this pandemic. People are stuck, set in their ways. And what we really need to do is get ourselves vaccinated.
Yes.
Everyone isn't a candidate for it, right? If you have some type of allergic reactions or something to things, the ingredients, you can't do it. But everyone else that can, you should, because you have to not just think about yourself, you have to think about other people, those you love, and strangers.
Yes.
If we get 80 to 90% of the people in the nation and the world to get
Mhm.
vaccinated, we're going to be safe. Like if you look at the flu numbers, the flu wasn't really an issue for us because people were
Yes.
wearing masks. So the
Right.
flu numbers went down a lot. But and then with the flu, you only had 40 to 50% of people that would take that vaccine.
Mhm.
So for this, we need 80 to 90%, and then we can get it under control.
So that's, I think, the next question I have for you. And, I want people to really listen, but, not just take it with a grain of salt, but just really take it in and evaluate. How would people go about, because I know they were doing segments like, you had your senior group, you had people that are teachers and people that are essential workers. They were on the first batch. Now it's kind of opening up because I think some cities were either behind, they weren't first in line. So we want to make sure that, the people that are, I think, more susceptible to catching it have the access to go and get it. So do you know like what else can they do? Can they go online and look it up, or is there a hotline, or I don't know.
Well, the CDC, they do have all these different links. And then I'm sure in each city, and your state, they have links too that you can go to. First tier was the essential frontline workers, whether that was nurses, doctors, the firemen, policemen, people like that. And then
Yes.
the next were the elderly, that was, I believe, 75 and above.
Mhm.
And a couple of weeks ago, maybe 2 weeks ago, they lowered it now, I think, to like 65 and above. And they've also incorporating like teachers now. But
Yes.
the problem is like, especially with our communities, you have the drug available, but some people don't have access to go get it. Like some people are truly homebound.
Mhm.
And I think I saw on the news yesterday, like in East LA, they were bringing the vaccine to certain communities because the people
Okay.
couldn't get to the
Right.
locations to get it. So it's, and it's like when you think about, do you have a child or someone that,
Mhm.
if it was a free turkey or something,
Mhm. Exactly.
they get out and get to those locations. If they were going to pay your light bill or your gas bill, but you can't get to the vaccine, it's really sad. This is life or death. That was a turkey, so
We have to look at it in
it's
that.
yeah. But it's slowly coming to, I mean, our president said yesterday, by the end of May, every American will have the vaccine if they want it. That's great. I mean, they sped it up. At first it was July and
Mhm.
now it's May. So it's available. You just have to
Yes.
go and get it.
Well, I think that's the main point, as you said, our communities, the community, our surrounding communities, the communities that we live in, the communities that you and I, went to school around. It's like those are the ones that are hardest hit. So we
Yeah.
want to take care of our seniors. We want to
Yeah.
take care of our, people that we know and love. It's like my whole timeline has been just bombarded, and my heart, I'm sensitive. I'm not going to say I'm desensitized, but I'm sensitive to the loss,
Yeah.
and definitely extending my condolences to anyone that has lost friend, family, just people. And
Yeah.
it's just not one person in the family. It's affecting the whole entire families. Some
Right.
families have lost more than 5 people. So
Right.
it's devastating. It's such a devastating blow. And so that's why I wanted to really talk about, have this topic with you, because you're very knowledgeable. This is your field. You excel in it. And I'm like, I need someone that can really shed some light, because I think people are just in the dark, or they've just been fed a lot of misnomers that hasn't been proven. And so I'm like, let's get to the bottom of it. Let's add some truth and light to the situation so people can see for themselves what's out
Yes.
there, what's available for them. And in the long run, so I guess that's my take. I'm looking at the longevity. So
Right.
it doesn't prevent COVID. It's just, if you should contract COVID, your lifespan can be extended.
Yes, you won't die from it. You'll recover, And then some people worry about the side effects. And it's like, what's the side effect if you get a fever or if you have a sore arm or some nausea? You're gonna live. But if you don't get it and you contract it, you can die.
Yeah.
So I'm like, I'd rather be sick for 1 to 3 days. It's not like people think you're getting the disease when you have those reactions. That's just your body's immune response fighting for you, building
Yes.
that immunity and those antibodies to help protect you.
That's so good. That's so good. So, what are some of the things that you would say our accomplishments, since you've been working in the field almost 30 years now? What are some of your notable accomplishments?
Well, one, when I was doing the sales, and I worked for like one of the largest companies in the United States. I won't say their name though.
Mm-hmm.
I was the clinical sales liaison of the year. And it was my first year with that company. And the two team
Wow.
members that were with me, we all won the award in our area and our branch. So every year after that, I was in the top 3. So
Congratulations.
yeah,
But see,
so
I
I was
think
doing pretty good.
part of that is your personality. It's so infectious. You have a beautiful smell, and you're very outgoing. So it's like you would just excel in that
Yeah.
field, that type of business. So that's wonderful. And now, what are you doing specifically, like with the education portion of your position?
So what I do is I make sure before a patient is touched by a nurse in the field that I vet them and assess their skill set to manage my patient. I give the final say, yay or nay, on that individual. Um, and so if I feel like they need some more education, I provide CEs. So I could train them one-on-one. I can train their whole company, like whatever they want me to do. But I want them to be comfortable, because my top priority is the patient. That's what my company believes in. And that's what I believe in as a nurse, patient first.
Patient
It's not
first.
about me, it's about them. This person
Yes.
is sick and they want to have a quality of life, and we want to help ensure they can live their best life,
Mm-hmm.
right? So they can be productive in their community and their family or their business.
Mm-hmm.
Um, so I also I write blogs, I do
Hmm.
webinars, and I assist the sales team if they need support out in the field. I
Mm-hmm.
assist our pharmacists if they have certain questions nursing related.
Mm-hmm.
We work together to come up with the best resolution for issues with the patients, or just educating patients if they have certain questions. And then I
Mm-hmm.
interact with the patients directly sometimes, so I can advise them on managing side effects or preventing side effects, or if sometimes if we just want them to know if they should reach out to their doctor or go to the ER.
Okay. Well, that sounds like a perfect marriage right there.
I
So,
love my job.
I'll
Yeah.
see that, that's wonderful because it's nothing like having someone who really gives it 100%. They show up, they're alert, they're present, they're in the moment, and they can give you their undivided attention. That says a lot. It says a
That's
lot.
what it's always about. Yeah. When I was with the patient, I never worried about my other patients like trying to rush out. I'm like, I have to give you my undivided attention so that you feel like I care. I
Mhm.
can't be trying to back out the door. You know what I mean? People can see that, and then you seem like you don't care or you're fake. So I don't do that.
Exactly. So, Kendi, leave us about three takeaways that people can, just put in their repertoire. They can say, okay, I heard Kendi say this on the podcast, and I think I'm going to adopt it. So, give us three takeaways for, either pursuing a profession in the medical field or just protecting themselves during this COVID outbreak.
Well, I say if you're interested in nursing, to go with it. If you're a caring person, I don't think you should do any job for money. People always think, oh, you're a nurse, you make good money. Don't get into it for that. Have a heart for people, because people are going to feed off that. I
Mhm.
always felt like my patients knew that. And some people said when I touched them, the pain in their body would go away sometimes. Like,
Mm,
you never know, a hug or just a gentle touch, and you
wow.
help people out. So that's one thing. As far as the pandemic, I would say we need to be more serious. We have states now opening their states and telling people they don't have to wear masks. And all that is confusing because that's the government. But we have to realize they have agendas, and we have
Yes.
to think for ourselves. Protect yourself and your family. We still need to social distance, wear a mask, wash our hands, and
Mhm.
get vaccinated. And then we'll be able to have a normal life in 2022, because it's not going to go
Yeah.
anywhere right now.
No, no.
And a
Wow.
third one, I would say take care of yourself. So
Yes.
you need to make sure you're eating well. You need to stay hydrated. You need to take your vitamins. You need to exercise, and you need sleep so that you can be
Mhm.
your best self.
Mhm. And I think the sleep part, a lot of us that are working from home and whatnot, we are binging. We've been watching a lot of Netflix. I'm guilty of it, so I'm gonna put myself in the category.
Me
But
too.
this month is my 30-30, so I'm taking 30 things that I want to improve in 30 days, and one of them is drinking water and less social media and less television. So
Ooh,
yeah, so it's also my birthday month. So March Madness for me
happy
and mine.
birthday.
Yes, yes, yes. Well, love, I thank you so much. I forgot to mention that you are a Shaw doll, and we rock for one another. So
Hey.
thank you for showing up. Thank you for saying yes, and thank you for just being you. I think
Well,
that
thank
just
you for
goes.
having me.
It just goes so far, and I just hope that people are taking your words of wisdom and applying it to themselves so they can have longevity and peace and harmony and love in their family in themselves, and just that we can work together. I think that's it. We are no one is on an island, no one is by themselves. We have
Right.
a community, and we need to tap in and check on one another So do a check in, like, hey, I'm checking in with you. You okay?
Yes.
Everybody, how's your mama and them? They fine? You good? You know, it's like I can send some groceries over to you and drop them off in the driveway. I just want to make sure that we're all doing our part, because it's too much for one person. But
it's about community.
if we all work together, we can get it done. We can get it done. So with that, love, I thank you and I appreciate you. And for my listeners, be inspired by
Thanks
love.
for having me.
Thank you for tuning in to Inspired by Love. Join us every Wednesday for the juice to be inspired. Like, follow, and share this podcast. Be sure to leave a positive rating.